Hi, friends. My client contacted me and said that he read on Yahoo News that if person takes PPIs, it's a good idea to take probiotic. He asked me to elaborate on this topic. I looked into that. Yes, it's correct. The guidelines at the end of 2023 changed. If person takes PPIs, it's a good idea to take probiotic with prebiotic because PPIs create dysbiosis. When dysbiosis sets in, people will start to have abdominal pain, nausea, vomiting, diarrhea, and constipation as a part of irritable bowel syndrome, because with dysbiosis, irritable bowel syndrome also sets in. This is all information in this video from article Proton Pump Inhibitor Induced Gut Dysbiosis. And basically, article goes into explanation how dysbiosis get created and what clinical symptoms people will have: vomiting, nausea, pain, abdominal pain, diarrhea. And it's all because the bacteria that lives in the digestive tract and controlled by hydrochloric concentration of this bacteria, controlled by hydrochloric acid, starts to proliferate and they become pathogenic. For example, in the stomach, staphylococcus showed up in the high concentration in small and the large intestine. Staphylococcus, streptococcus, and Clostridium difficile bacteria also will set in. So people should take a probiotic, the article suggests, right? So I have experience in the past as a physician with broad spectrum probiotic from Progressive Labs and has 10 different bacteria per pill and 10 billion bacteria per capsule. It's a good. However, recently, I discovered and have a good feedback from my clients that so-called soil probiotics also work very well. So we experimented, people have a good results. They have 28 multiple strains, soil-based organism. So go ahead and try that. I am done with this video for people who are watching my videos for 2 minutes, 38 seconds. The rest of the video is explanation for people who need more explanation. What will happen when we take PPIs and why dysbiosis sets in? I should tell you right up front, there are no new insights in our understanding to the fact that dysbiosis sets in, right? We knew that hydrochloric acid that produced in our stomach has two main purposes. One is to break protein, digest protein, and second is to kill the bacteria, viruses, and fungus that come into our digestive tract with the food. If they are not get killed or neutralized by hydrochloric acid, those bacteria go down into small intestine, they start to proliferate, and they create clinical symptoms. But there is one interesting fact that this article brings our attention to. And let's go into the blackboard and let's talk about that. I already pre-drew my favorite picture of the digestive tract. This is the mouth with the teeth. This is an esophagus. This is low esophageal sphincter. This is the stomach that is producing HCl, hydrochloric acid. At the end, we have pylorus. This is the small intestine where we have bacteria that helps us to digest food and produce some vitamins. This is the large intestine, and this we are going to the bathroom right here. When person takes PPI, it will, some of them, by the way, will block the production of hydrochloric acid irreversibly. Some don't. So as a result, you take a PPI, production of hydrochloric acid goes down. There is less hydrochloric acid. Bacteria and viruses and fungus that come into the stomach did not get killed. Then they go from here to the small intestine, start to populate small intestine, large intestine. And then as a result of that, population of pathogenic or semi-pathogenic bacteria will start to develop inflammation right here. But there is one interesting fact in this article. It talks about systemic effect of PPI on our body. So what happens, PPIs get absorbed through the digestive tract into our bloodstream and exhibit its effect onto individual cells. So here is the individual cell. So this is the nucleus and this is the cell. So, and the particles of PPI get delivered right here. Under normal circumstances, when the cell get insulted, and insult could be different. It could be physical, right? Cells get bruised here, or some chemicals injured the cell, or let's say bacteria and virus came here and also injured the cell. Cell is reacting to that, and reaction is production pro-inflammatory substances, and they are, there are many of them, but I name few: interleukin 6, interleukin 8, tumor necrotic factor, nitric oxide. All of these pro-inflammatory substances get released into the bloodstream. With the bloodstream, they circulate and they go to immune system. And for immune system, it's a signal. Hey, listen, we have a problem. And immune system start to produce substances that will go back here. Well, let's draw them white. So, like, for example, natural killer cells, or it will produce antibody, and they will go here into the site of inflammation. Look here, oh, there are a lot of debris here from the cell, and look at that. There is a bacteria and viruses here, and it will start to attack. Bacteria, viruses, it will eat debris of the cell, and that's how inflammation gets resolved. Now, PPI's systemic effect is decreased production of inflammatory substances. As a result, there are consequences of the decreased production of inflammatory substances. Some are positive and some are negative. Let's go and look at them. Here is what we can consider a positive effect of PPIs. They will help to deal with acid reflux, and they will decrease production of pro-inflammatory substances, interleukin 6, 8, tumor necrotic factor, nitric oxide. As a result, natural killer cells will be decreased. Benefits of that is it helps to fight certain diseases such as liver cirrhosis, idiopathic pulmonary fibrosis, and inflammation in the digestive tract. And what I started to see more and more as I consult people come to me and they say, hey, listen, I did not have exactly PPIs for acid reflux. Remember, PPIs prescribed mainly for 2 reasons. Number 1, acid reflux, burning sensation or laryngopharyngeal reflux. And 2 is a part of the treatment for H. pylori. So people say, I did not complain about acid reflux. I just had an inflammation in the digestive tract, gas, bloating, and maybe occasionally acid reflux. Get prescription of PPIs. When you get the prescription of PPIs, I strongly recommend to consider pros and cons. So pros, clear. Here is the cons. The longer, by the way, longer you take PPI, the higher concentration, and the longer you take, the higher chance that you will start to exhibit side effects of that medication. What the side effects? SIBO, IBS, anemia, magnesium and calcium deficiency, fatty liver disease, and lung infection. Now, ask me a question. Why is that people develop community-acquired pneumonia? And by the way, this is a very well-known side effect for a long time for PPI users. Well, here is the explanation. When we breathe air in, together with the air, bacteria, viruses, and fungus go in. The moment they landed in the pulmonary system and started to create the damage there, right? Every single cell started to release those pro-inflammatory substances, interleukin 6, 8, tumor necrotic factor. This is the way to communicate for our body with immune system. If immune system does not get that signal, it does not have a clue what's going on, that inflammation, a pneumonia is taking place. And it just does not care because there is no signal for that. Now, if this is the true for pneumonia, I want you to think about that further. There are other places in our body that come into contact with environment. And actually inhibiting pro-inflammatory substances will create inflammation there because bacteria will go there, which they are. Think about that. Here is the place of contact with the environment. Nose and the mouth also come in contact with all kinds of bacterial and viral infection. Immune system does not react if you take PPIs. For females, think about that, vaginal infection. And I don't mean that immune system will react into syphilis, gonorrhea, or trichomoniasis. I'm talking about the bacteria overgrows, not exactly pathogenic, but benign that start to grow more, and women have vaginosis or vaginitis, right? So just think about that, all right? So when you take PPIs, it's a good idea to take probiotic with prebiotic, but also think about it. Do you really want to take it? Okay, guys, that's it for today. If you haven't, you know what I want to share with you? I want to show you one more slide here on this. Let me show you one more slide just to show you out of curiosity. When I looked at this slide, do you remember I saw that, you take PPI and you create dysbiosis. Dysbiosis created in oral cavity. Dysbiosis created in the esophagus. All kinds of bacteria, including Clostridium difficile, start to grow in the esophagus. What does it mean to us? It means that inflammation is in the esophagus. It means that esophagitis due to PPI, okay? So isn't that interesting? Oh, there is one more slide. I forgot about that. Look at that, unpublished data. They are talking about that when people take PPI, there is a higher chance that they will develop multiple sclerosis, Crohn's disease, rheumatoid arthritis, all autoimmune conditions. And then increased risk of salmonella and Clostridium difficile colitis. So all this is digestive complaints. And due to C. diff colitis associated with a higher mortality because it is so difficult to treat. Okay, guys, finally, I am done. Thank you very much. Like, subscribe. Bye-bye for now.